All right, so here we have a type 3 patient. And the reason why I say that is that when you assess him, he's got the loose skin that will move up and down. And most importantly, when he runs or jumps, he's going to get some bouncing. And a lot of men can relate to that. So that makes it a type 3 because we're not just dealing with gland, we're dealing with skin as an excess. And the skin is the bigger problem often than the gland is. So here's how you optimally treat a type 3. So what I've done is I've got a lot of marks here. I'm going to explain them a little bit. This mark right here, I'm just showing where the bottom of the pec major is, and then the lateral border of the muscle. So this is the chest. Everything below that is on the abdomen. So you can see his nipple is actually falling off of his chest. If we were to simply remove that volume within his gland, he would deflate. So it would be turning a grape into a raisin. And what would happen is that nipple that's right at the bottom of the pec major, it would be about 2 centimeters below, and it would not look good. And it happens all the time. So what we have to do is we have to do several things. One, we need to remove tissue in what I call the hockey stick distribution, meaning that anything that's lateral to the pec here and anything that's below the pec here, we need to remove. But we do need to preserve the volume up here so he doesn't deflate. It just doesn't create a flat chest. Plus, we also need this line here represents the blood vessel that comes into the nipple. So because we're going to be making a donut, we need to keep that blood flow intact. So let me just finish by explaining what's going on with the blood flow and the donut lift. So this is the donut lift. And what I've done, and you can mark up to 1 diameter above and 1 diameter below and still get a good incision. It will look good if it's done correctly. And because we need to lift the nipple, this is going to lift it that amount. But going in and removing all the volume and then making an incision around the areola can be fraught with vascular problems because how does the blood get in? So that's why I've drawn this black line. We're going to maintain a blood flow that keeps this vessel intact, allows us to move the nipple up, and then gets rid of everything in the hockey distribution, and it also then minimizes the overall volume in the chest. So that's a type 3.